Hi, welcome to talk about Valganciclovir for symptomatic cytomegalovirus disease. What is cytomegalovirus? Cytomegalovirus is a common virus that can infect almost anyone. Once infected, your body retains the virus for life. More people don't know they have cytomegalovirus because it rarely causes problems in healthy people. Okay, but if you're pregnant or have a weakened immune system, cytomegalovirus is cause for cancer. A woman will develop an active cytomegalovirus infection during pregnancy can pass the virus to her baby, who might then experience signs and symptoms. For people with compromised immunity, especially due to organ transplantation, cytomegalovirus infection can be fatal. Cytomegalovirus spread from person to person through body fluids such as blood, saliva, urine, and semen, and breast milk. There's no cure for the virus. However, medication can help. There's newborns and people with weak immune system. Most babies with congenital cytomegalovirus appear healthy at birth. A few babies with congenital cytomegalovirus who appear healthy at birth can develop signs over time, sometimes not for months or years after birth. The most common of these late occurring signs are hearing loss and developmental delay. A small number of babies may also develop vision problems. Babies with congenital cytomegalovirus who are sick at birth tend to have significant signs and symptoms, including premature birth, low birth weight, yellow skin and eye, enlarged and poorly functioning liver, purple skin splotches or a rash or boot, normally a small head, enlarging spleen, and pneumonia. Okay, Valganciclovir is a product of ganciclovir that is activated in the gut and liver to ganciclovir. Valganciclovir is used for treatment in celiac cytomegalovirus case. The National Institute of Allergy and Infectious Disease collaborative antiviral study group found that among neonates with symptomatic congenital cytomegalovirus disease involving the central nervous system, ganciclovir administered intravenously over a period of 6 weeks was associated with improvement audiology outcomes at 6 months of life. But there was a suggestion that this benefit could wane over the first 2 years of life. Treatment infants had fever development delays. According to Denver developmental evaluations, that's untreated infants. Therapy with intravenous ganciclovir or oral valganciclovir for 6 weeks is now an accepted treatment option for patients with symptomatic congenital cytomegalovirus disease involving the CNS.
Ganciclovir or DHPGGUANINE, alternative spelling, ganciclovir is an antiviral medication used to treat cytomegalovirus infections. Ganciclovir sodium is marketed under the trade names Cytovine and Simevan. Ganciclovir for ocular use is marketed under the trade name Bitrazert. A prodrug form with improved oral bioavailability has also been developed. Mechanism of action: ganciclovir is a synthetic analog of 2-euro-deoxyguanosine. It is first phosphorylated to ganciclovir monophosphate by a viral kinase encoded by the cytomegalovirus gene UL97 during infection. Subsequently, cellular kinases catalyze the formation of ganciclovir diphosphate and ganciclovir triphosphate, which is present in 10-fold greater concentrations in CMV or herpes simplex virus infected cells than uninfected cells. Ganciclovir triphosphate is a competitive inhibitor of deoxyguanosine triphosphate incorporation into DNA and preferentially inhibits viral DNA polymerases more than cellular DNA polymerases. In addition, ganciclovir triphosphate serves as a poor substrate for chain elongation, thereby disrupting viral DNA synthesis by a second route. Clinical use. Indications ganciclovir is indicated for sight-threatening CMV retinitis in severely immunocompromised people, CMV pneumonitis in bone marrow transplant recipients, prevention of CMV disease in bone marrow and solid organ transplant recipients, confirmed CMV retinitis in people with AIDS. It is also used for acute CMV colitis and HIV/AIDS and CMV pneumonitis in immunosuppressed patients. Ganciclovir has also been used with some success in treating human herpes virus 6 infections. Ganciclovir has also been found to be an effective treatment for herpes simplex virus epithelial keratitis.
Okay, application in medicine, treatment of congenital infection by cytomegalovirus, cytomegalovirus retinitis induction treatment, and cytomegalovirus retinitis maintenance treatment.
Hey guys, welcome back to USMLE team. Today's topic is ganciclovir. This is an antiviral drug. Okay, so before starting this, I would request you to subscribe to our channel and tell your friends to subscribe because we need your subscriptions. Your subscription helps us to build more and more videos, confidence. Okay, so we need your support by subscribing. Let me start with this. I will be discussing only important points related to USMLE step 1. It's an antiviral medication used to treat or prevent CMV infection. So it is most commonly used in the CMV infection patients. Okay, Valganciclovir is a synthetic analog of 2-deoxyguanosine. It is first phosphorylated to deoxyguanosine triphosphate analog, and this completely inhibits the incorporation of GTP by viral DNA polymerases, resulting in the termination of elongation of a viral DNA. So this is how it acts. Indications are, as I said, in CMV infection, like sight-threatening CMV retinitis in severely immunocompromised people like HIV. Okay, CMV pneumonitis in bone marrow transplant recipients, prevention of CMV disease in bone marrow and solid organ transplant recipient. Okay, confirmed CMV retinitis in people with AIDS. That's what I told you. It is also used for acute CMV colitis in HIV AIDS and CMV pneumonitis in immunocompromised patient. Ganciclovir also has been used with some success in treating human herpes virus 6 infection. Okay.
Okay, the pros: intravenous ganciclovir treatment decreases the risk of progressive hearing loss in children with symptomatic infection and central nervous system involving, although it should be given intravenously for 6 weeks.
This is San Diego's news channel, KUSI News.
Coming up here on Good Morning San Diego, we're going to talk to the La Jolla Institute for Allergy and Immunology. This is all about their advances towards a first ever vaccine for the infectious cause of congenital birth defects.
It sounds confusing, but we'll find out about it. Well, researchers at the La Jolla Institute have made some advances toward a first ever vaccine for the infectious cause of congenital birth defects. Associate professor from the La Jolla Institute for Allergy and Immunology, Chris Benedict, is here to talk about this. It has a long name, Cytomegalovirus. Is that right?
Yeah, that's right, actually. Cytomegalovirus, or CMV for short, is a virus that most people have never heard of, but actually infects more than half of us here in San Diego.
A lot of people have this, don't they?
Yes. I mean, in fact, more than half of us in San Diego and around the country have been infected with CMV.
So why is it important to fight it?
So the reason that it's important to fight it is because CMV, it really doesn't cause a problem in those of us who have a healthy immune system, for instance. But the problem that CMV causes is in people who have a weakened immune system. For instance, like you led with the number one infectious cause of birth defects. Right, when CMV infects a baby developing in the womb, for instance, that is a major problem because that baby doesn't have an intact immune system. And then that's the reason why CMV can cause problems in those babies.
So it is important to identify the people who have the virus, and now you may have a way to fight it.
Yes, so the discovery that we've made, actually, CMV is a very big virus. Okay. So, for instance, we think it has more than 700 genes. And that
makes it harder to fight, too.
Yeah, exactly, because that contrasts, for instance, with the flu, which everyone has heard of. Sure. That virus has 9 genes. Okay. So what we've actually done in the laboratory is to sort of pinpoint one of these 700 genes that does a very good job at sort of cloaking the virus and tricking out our immune system and avoiding it from being killed or cleared. From
I mean, this is an oversimplification, but the theory then is if you found a mother who is pregnant and you identify that she has this virus, you can begin to fight this virus before it affects the child.
Yeah, that's right. And in fact, maybe even the more dangerous case is that if we have a mother who hasn't been infected with this virus before, because remember, half of us are infected early in life and half of us aren't. And so if you have a mother who hasn't been infected and she's pregnant, that mother would be the most at risk. If she gets infected during pregnancy, then the virus could potentially then infect the developing baby, of course, a very innocent case, and cause the problems that we talked about.
How long have you guys...
Okay, that counts. There are no dosage studies in older patients. Can cause anemia, neutropenia, hypertension, tract infections, upper respiratory, diarrhea, nauseas, vomiting, and constipation.
New research by UAB shows promise in a vaccine that has the potential to prevent maternal and congenital cytomegalovirus, or CMV. The study was published this month in the New England Journal of Medicine.
So what we were doing in this trial was taking a novel vaccine and for the first time trying to determine whether it had efficacy to prevent infection in women of childbearing age.
CMV is a member of the herpes virus family and is commonly transmitted by a pregnant woman to her unborn child. 1 in every 100 babies born in the U.S. are infected with CMV.
The problems that are of greatest concern are those that result in damage to the central nervous system. So, for example, mental retardation, cerebral palsy, and hearing loss.
This phase 2 clinical trial looked at 441 CMV-negative women who received either the vaccine or a placebo within 1 year of giving birth. Data showed encouraging results.
The probability of remaining uninfected, that is, the probability of not getting CMV, was higher, significantly higher for women who got the vaccine than for women who got placebo.
Dr. Pass says that while a larger phase 3 clinical trial is needed to confirm efficacy of the vaccine, the results are promising.
Okay, issue applied in Ecuador. In Ecuador, there is not a lot of data that will allow us to have numbers of incidents of cytomegalovirus. In other words, the use of molecular methods for diagnosing cytomegalovirus in pregnant women is restricted to population that flocked at field health homes.
Cytomegalovirus infection is a viral infection. It is commonly known as CMV infection. It presents with simple symptoms like headache, body aches, sore throat, and fever. Most of the people who has CMV infection doesn't even know that they got infected. However, people with low immunity are the ones who suffer serious illnesses, sometimes life-threatening as well. Newborns are at very high risk of developing CMV infection, which leads to what we call as congenital CMV infection. Congenital CMV infection is the most common viral infection with a prevalence of 0.5%. This is a major source of childhood disability, which includes visual impairment, hearing impairment, and cognitive impairment. Congenital CMV is caused by pregnant women who acquire CMV infection in their pregnancy for the first time, transmit this viral infection to their babies. It is estimated that around 33% of these pregnant women who have been infected with CMV will transmit to their babies.
Okay, conclusions. In conclusion, Valganciclovir may be a good alternative to intravenous ganciclovir in children with symptomatic congenital cytomegalovirus infection, can facilitate outpatient treatment and may alleviate problems arising for an intravenous access prolonged.
Is a specialist in infectious diseases, and he's also the director of the Open Medicine Institute. Please welcome Dr. Andreas Kogelnik. Hey, doctor. Thank you so much for being here. So tell us about this disease, chronic fatigue syndrome.
Yeah, it's a difficult one because there's not great ways to diagnose it, and we haven't until recently have great ways to treat it either. So it's been a little bit of a medical mystery, so to speak.
Does it tend to get to a fairly advanced stage before it's diagnosed? Is that the problem?
It's pretty variable. Part of the problem is that there's these overlapping symptoms that are very general in context, like you said, fever, joint pain, swelling, lymph nodes, sort of flu-like symptoms that are maybe sort of the worst flu you've had.
Oh my goodness. So, you know, the way you say chronic fatigue syndrome, it just sounds like you're tired, but it's actually much more serious than that.
That's right. I mean, these are symptoms that go on for months and even years at a time. People can be bedridden all the way to, you know, losing their jobs, becoming disabled. And the CDC definition of it is a minimum of 6 months of some of the symptoms that you described.
Minimum of 6 months. So who is most at risk?
Well, that's a great question. The population studies that have been done by the CDC and others haven't really figured that out yet directly, but what we think is that there's some viral triggers that are going around that have been doing this for many years, and that really puts all of us at risk to a certain extent.
So is it like contagious, you think?
There's a factor of that in there, certainly.
Okay. And what about kids? There are some suspicions that kids are diagnosed, but they don't know they have it.
Yeah, we have our age ranges for patients range from about 2 years old all the way up into the 70s. And there's some estimates that are saying that 1 in 500 kids, school-age kids, are out of school and missing school because of this disease.
You mentioned something about the viral strains going around. What do we know what the causes are?
Well, we don't exactly. There's been a lot of implication around some of the various herpes viruses. So Epstein-Barr virus, which causes mononucleosis, herpes 1 and 2, Cytomegalovirus, and then a host of other diseases as well, including parvovirus and some bacteria as well.
So is it like all attacking your body at once or something?
Well, the thought is there's some changes in your immune system that are happening either because of these organisms or because of other pathogens that are out there.
Right. Do you think it's preventable?
That's a great question. I don't think we know enough about it yet to really answer it.
But there's no cure?
Well, we've made some strides in terms of treatment with antivirals in the last year or so. So there's a lot of optimism, and we're working hard on getting better diagnostics and different treatments out there.
So these treatments can enhance your quality of life to what degree?
Well, we've taken people from being, as I said, bedridden or wheelchair-bound to being fully functional again, or at least giving them a lot better quality of life.
So the condition is still there, just in either an arrested or an improved state?
I think we've seen a lot of improvement in a lot of patients, and that's a great cause for optimism. The question now is whether we can sustain that over longer and longer periods of time.
Gotcha.
So where are we right now? Are we testing like drugs and things like that?
Right, so we've got some clinical trials that we're teeing up for the fall and into next year with various immune agents and antivirals, and the challenge is figuring out who fits in which category, so there's a lot of variability in terms of who responds to what drug.
So if the symptoms are so generic, I mean generic meaning it could be the flu, it could be you have a virus, how do you know if you have CFS?
Well, what we're looking at is doing sort of more in-depth molecular profiles on these patients, but the average person isn't really going to know except that they're going to be sick for a long time, and it's sort of the flu that doesn't go away is one way of looking at it.
What do you mean?
Okay, thank you so much. Bye-bye.